A modern lifestyle of processed foods and constant eating creates an invisible biological debt. For many, this table is the inevitable destination. Increasingly, the victims arriving here appear to be in peak physical condition. Cardiologists are now treating patients in their late 20s for massive fatal heart attacks. These events are the culmination of a 10-year biological blind spot, a silent internal countdown that ticks away for a decade before a single symptom registers. Physical appearance is a poor metric for cardiovascular safety. Our survival is governed by internal biological clocks that we are currently misreading. We are taught that running for hours on a treadmill or cycling long distances is the benchmark for a healthy heart. But relentless steady-state aerobic training creates a constant stream of oxidative stress. This sustained exertion overwhelms the body's natural cleanup chemicals, specifically an antioxidant called glutathione, leaving behind toxic metabolic waste. Without a break for these chemicals to reset, reactive oxygen species circulate unchecked, actively tearing at the delicate inner lining of the arterial walls. The body's ability to neutralize this debris is a rate-limited process. By using short, 30-second sprints followed by full rest, high-intensity training provides the specific window required for glutathione to clear the metabolic mess before the next burst begins. Overworking the heart without these recovery windows doesn't strengthen the muscle. It accelerates arterial damage by stripping away the body's natural defenses. When we consume processed carbohydrates, glucose floods the bloodstream. To prevent this sugar from damaging the blood vessels, the pancreas releases insulin to push the glucose directly into our cells. A diagnostic flaw. Standard blood sugar tests appear stable, while massive insulin surges are secretly needed to keep sugar down. This gap is hyperinsulinemia. For 10 years, these spikes force energy deep into the abdomen, creating toxic visceral fat around the organs. This chronic background insulin narrows the blood vessels and drives dangerous systemic inflammation throughout the entire human circulatory system. A normal blood sugar test provides a false sense of security, while a decade-long hormonal fire burns down the cardiovascular system from the inside. Systemic inflammation and environmental toxins alter our cholesterol, shrinking normal lipoproteins into damaged, small, dense LDL particles. These dense particles are small enough to lodge inside the microtears of the arterial wall, the exact tears caused by oxidative stress and high insulin. Heart disease does not operate like a rusty pipe, with sludge slowly accumulating on the inner walls until the tube seals shut. The blockage is an inflammatory pimple, a fibrous plaque growing underneath the artery wall's lining, not on top. This arterial pimple sits highly pressurized, reacting constantly to inflammation from visceral fat, forming a structurally unstable blister. The real danger inside our bodies isn't a pipe slowly sealing shut, but a highly pressurized toxic pocket waiting for the exact moment to pop. When inflammation reaches a tipping point, the membrane finally fails. The pressurized arterial pimple cracks open, releasing debris into the bloodstream. The body recognizes this crack as a standard injury. It immediately rushes to form a rapid blood clot over the rupture to heal the wound. It is this sudden, massive blood clot, not the original plaque, that instantly cuts off circulation to the heart muscle. A heart attack is the body's misguided attempt to heal an inflammatory rupture, turning a microscopic crack into a total cardiovascular shutdown. Defusing this ticking clock requires a mechanism that repairs the artery lining from within. Unlike a calorie deficit, which slows the metabolic rate and breaks down muscle, true fasting initiates a distinct hormonal shift towards cellular repair. At the 12-hour mark of a fast, insulin levels plummet. This allows the body to shift its energy consumption toward the dangerous, inflammatory visceral fat. This state triggers autophagy. The body begins breaking down damaged cells and redundant organelles, making the entire cardiovascular system vastly more efficient. Breaking a fast then releases a surge of fresh stem cells from the bone marrow. These cells actively rebuild the damaged endothelium, or artery lining. Fasting initiates a state of structural maintenance, purging inflammatory tissue while triggering the bone marrow to reinforce the structural integrity of the arterial walls. This is the statin gap. Standard cholesterol medications are merely a band-aid waiting for the patient at the very end of the 10-year clock. While statins successfully lower total LDL volume, they fail to fix the root cause systemic inflammation or repair the small, dense nature of the damaged particles. The modern medical system is designed to treat the final symptom, the clot, but it is blind to the 10-year invisible cause, hyperinsulinemia. True cardiovascular survival requires lowering your insulin and triggering your own internal reset before the 10-year clock finally runs out.